Hi, everyone. It's Kristen Willard with GAAPP. I'm so lucky today to be joined by my GAAPP colleague, Obi Nwangoro from Nigeria. She works with GAAPP and also her own organization in Nigeria. And she's going to talk to us a little bit today about access to inhaled medicines in her country. So, welcome. I'm so glad to speak with you today and to have this chance to be with you one on one.
Thank you very much, Kristen. I'm glad to be here to talk more about access to inhaler in Nigeria. Thank you very much.
Thank you, Obi. Do you want to just tell us a little bit about yourself and your organization?
Okay, I work presently with GAAPP as the African and Middle East Regional Administrator. And I am attached to my organization in Nigeria, an NGO, ASMACARP, Asthma Relief Campaign project, and is a member organization to GAAPP as well. Thank you very much.
Wonderful. So good. We're lucky to have you in both capacities. So let's start talking a little bit about access in Nigeria specifically. So how easy or difficult is it for people to get their inhaled medications in Nigeria?
Yeah, I'm very happy once again to talk about this because trust me, it's very difficult to access inhaled medicine in Nigeria. Presently, a lot of people are going through a lot to make sure they have access to this inhaled medicine, which inhaler is one of it. And I think the major cause of this difficulty, the experience is lack of the availability of some of these inhaled medicines. And one of the causes of it is because some of the big pharmaceutical companies that produce these inhalers, they are no more in Nigeria, which is a very major problem. And I heard that the reason why they left Nigeria is because of the monetary policy that brought about devaluation of naira, and it made them not like target companies, manufacturers were not able to meet targets, and some of them have to leave. But presently, because of inhaler is above $5, and some people, especially in the rural areas, cannot, trust me, they cannot afford it because even our the take-home pay for an individual. I think I have another word for it. I'll remember later. Is not even up to $50, for a person. If you convert it to Nigerian currency, naira, it's about 70,000. And by now, some people have not even started paying that amount. They still pay below. What's the word I've forgotten, but it's fine. I will get to it. So what I mean is that when you buy an inhaler that may last for like a month at the rate of $5 minus $5, subtract $5 from the $50. You trust me, you will go home with maybe like less than $40. Some families have children, they have other needs, and inhaler may just last for like less than a month or 1 month, and they have other things that they need money for. So I asked the question: how will these families survive? How will they eat? How will they take care of, manage the, say COPD or asthma for those that have COPD? How will they manage themselves? And secondly, the government in Nigeria, I can beat my chest, they are not making it easy for people. The healthcare system is not functional, and sometimes you get to these government hospitals where you can get inhaled medicines cheaper. They are not available, they are nowhere to be seen, and people will have to go to private organization, private hospitals, and you find out that the few ones that they are able to see there are very expensive. Yeah, so these are some of the things that makes it difficult, and also some patients will not be able to travel out, especially those in the rural area. Cost of transportation to where they can get access to these inhaled medicines are too expensive for them. And sometimes some of them may not know how to read and write, language barriers. Some of them are looking up to see if they can get organizations like ASMACARP coming down there to, create awareness, teach them more on how they can manage themselves with these illnesses. So yeah, those are some of the so many difficulties that they face, to finding out access to inhaled medicines.
Yeah,
Thank you
those
very
are
much.
goodness, those are significant barriers, and you describe them so beautifully. I One of the things you mentioned was difficulty working with the government, or their maybe lack of efforts in trying to improve access. And one of my questions is, are there programs, whether they're sponsored by the government or otherwise, that help to increase access?
So yeah, I think the only, not just the only way, one of the ways where the international organizations or big pharmaceutical companies can help is to partner with some smaller organizations, NGOs, non-governmental organizations that are in Nigeria, to make affordable these inhaled medicines, because at the moment it's quite expensive. Many people cannot afford this. So I think if it's possible, they should just try and see how they can make it cheaper, And also, if possible, I would like the organizations outside Nigeria, bigger ones, to like support the smaller ones by, providing funds to reach out to these other people, to go to the rural areas where the people are lavishing in poverty, to help them so that they can create more awareness. It's not something that stops. You keep doing it. And then, for example, one of the members, the ASMACARP, also have a book that they have printed in so many languages now, 3 major Nigerian languages. This is just a very good development, because it will help those that cannot read or write, those that misunderstand these management techniques. They can be able to read through the languages, and then they understand more on how to manage these diseases, respiratory diseases, because there are still other ways that you can manage it that are not just inhaled medicines. But when they are able to read and understand by themselves, I think it will go a long way. So I plead to the international organizations to come to our aid in Nigeria. People are really suffering. People are dying on a daily basis. Some don't even know that the cause of death is, mismanagement of these diseases. Some think they are like, a cultural thing, witchcraft coming to attack them, not knowing that this is something that you can manage. So yeah, I plead to international organizations to help us fund a small organization, and then and create awareness, and also work on research. Also, see if they have more avenues to support people living with respiratory disease in Nigeria. Thank you very much.
Thank you, Obi. Let me ask if in closing there's anything else that you want to say in wrapping up, and also if there's any websites that you would like to include in the video for people in Nigeria.
I will add that if anybody want to reach out to GAAPP, my organization, they can reach out through me or through Asthma Relief Campaign Project. Asthma Relief Campaign Project is in Abuja, Nigeria, and we have another office in Lagos, Nigeria as well. And we are based in Number. Just reach me, and then we'll take it up from there. Thank you very much.
Obi, thank you so much. This has been so helpful, and I think will give insight into access issues in Nigeria for people who have not considered this before. So thank you. And I'm so lucky to
Well,
work with you.
same here. I appreciate you. Thank
You
you.
too. Thanks.